Welcome all to the Engineers Ireland academic webinar on virtual labs, embracing a hybrid future. So I'm going to pass over to the Engineers Ireland Academic Society chairperson, Kevin Delaney, to give an opening remark.
Okay, welcome everyone, and I see we still have a few participants coming in here as we talk, but I think we'll continue anyway. So welcome everyone. It's great to see so many people online for the webinar today. As Owen said, I'm Kevin Delaney. I'm the chair of the Academic Society of Engineers Ireland for this academic year, and I'm also a lecturer of mechanical engineering and an educational developer for the Enterprise Academy, which is a joint HCI project between UCD and TU Dublin. Engineers Ireland is the voice of the engineering professional in Ireland and has been so since 1835. At the moment, we have over 25,000 members. The members come from every discipline of engineering and includes student members, chartered members, and fellows of the profession. The Academic Society is one of many networking groups within Engineers Ireland, and it organises a series of events, typically webinars like this one, throughout the academic year. It's open to engineers and non-engineers, members and non-members of Engineers Ireland. We have members from all the universities, technological institutes and institutes of technological universities and institutes of technology in Ireland. And we're also open to suggestions for future webinar topics of relevance to engineering educators. This webinar, the first in our series of webinars for this academic year, is titled Virtual Labs, Embracing a Hybrid Future. As engineering educators, we must all consider how we can learn from advances in technology, educational theory, and the expectations of industry. We must understand the links between them and consider how it can change our approach to course development and course delivery. We have an opportunity here today to listen to the experiences of practitioners who have been embracing this hybrid future. And on behalf of the Academic Society, I would like to thank them all for sharing their experiences with us. I'm really looking forward to hearing all our presenters. And with that, I will hand back to Owen. Thank you.
Thanks very much, Kevin. So we have three exciting speakers here today. We've Dr. Stephen Hilton from University College London, Alan MacDonald from Technology University Dublin, and Dr. Jerry Reen from University College Cork. We have a questions and answers session at the end of the three speakers. So if you have questions during the session, please add them to the Q&A function. So our first speaker is Dr. Stephen Hilton, who is Associate Professor in the School of Pharmacy at University College London. While Dr. Hilton is a synthetic chemist, his interests and skills are truly cross-disciplinary, having skills in everything from CAD to microelectronics to flow chemistry. His current research interests include 3D printing of flow reactors, robotics for chemical synthesis, polymer development, and virtual reality for teaching. Sorry, Stephen, if I've missed a few, you can fill in. Dr. Hilton has published widely, including in educational journals such as Chemical Education. Stephen's use of VR to expand the reach of his outreach programs is particularly inspiring. He's developed fully rendered realistic VR environments in his labs and equipment at UCL to teach various skills to his students. But I'll let him tell you all about that himself. Over to you, Stephen.
Thanks, Owen, for the lovely introduction. All right, so really what we've done, a lot of our work has been based on need, and a lot of it has been driven by the developments in the group. So first, I'll talk about need. This is Matt. He was a postdoc in my group for 7 years. Absolutely fantastic, amazing chemist, amazing for technology and developments. But 2 years ago, he left my group. Now, when someone leaves, all that knowledge they have inside here goes with them. The other thing that actually has been developed over the last few years, and it's driven a lot of our need with virtual reality and 3D printing, has been this, the ICA Flow. So this was a piece of equipment that was developed in my group, and we partnered with ICA to bring this to market. And these two stories shown here really are key to our developments in virtual reality and more latterly in AI. So the loss of Matt when he left to take up another job, and development of the ICA Flow. So why technological convergence? Well, as a chemist, we do a lot of chemistry, so flow chemistry. And we developed the ICA Flow using 3D printing and low-cost electronics. More lately, we're looking at virtual reality. And partly with this is because of developing new technologies. When you develop new tech, how do you train people on that? And we use VR for that purpose. But more recently, we've started to think about AI. How can you build knowledge into these digital environments that is then available 24 hours a day, 7 days a week? So we like to think of it as convergence of technologies. The chemistry, the science behind this, the combination with 3D printing, low-cost electronics, and virtual reality, all tied into a digital interconnected environment. So as a chemist, how do we get here? Well, a lot of it revolves around the story of the ICA flow. So we were developing a flow chemistry system in our lab for low cost aspects in about the 2019 mark. So in 2018, this was our first concept product that we made in the laboratory. Our first in-house flow system. You can see it's warts and all, it doesn't look very nice. But using 3D printing, we were able to modify this and adapt it to our first published prototype in 2019. In March of that year, we partnered with ICA to think about bringing it to market. And obviously, as we all know, the pandemic hit. Here you can see my chief scientist working on this at home during the pandemic and how we actually then looked at taking this to market. And in 2020, we finally launched this. Now, bringing a product to market isn't easy, as we all know. But doing this in a pandemic, it's really, really difficult. And this is where virtual reality started to become an idea and then became, over the last 3 years, a realized product. Because when we were taking our designs with, in partnership with ICA, we had our CAD designs, we then had our physical products, and at the time we were flying back and forth to visit each other in Germany and the US, and we could do this with ease just before the pandemic. But as soon as this hit, that stopped. And in developing products, you want to be able to meet up and do this together. And the only way we could think about at the time to do this was to use virtual reality. By placing on the headset, we could meet in virtual reality and pass items back and forth to each other. And this is a fantastic way to think about the utility of virtual reality. So between us in the UK and colleagues in Germany and the US, we could meet up, use some commercial software, and get on with what we wanted to do and start to develop the product. So really, I think the pandemic has been a big driver in changing the group and I guess globally. Challenging production during the pandemic was a massive problem. The COVID-19 solutions which we found were 3D printing and virtual reality to cover a lot of these manufacturing difficulties and the meeting up and global collaboration. And a lot of our early work focused in the pandemic on developing PPE for the health services. And one of the problems was face shields in the first couple of weeks of the pandemic was a massive supply for the health services. Also with oxygen flow for the NHS and patients. And because of our work in 3D printing, we got pulled into this very early on. And so working with a big group of academics across UCL and manufacturing hubs, we looked at manufacturing thousands of face shields across the NHS in a very short number of days and early weeks of the pandemic. But this was our working environment. Over here on the left-hand side, you can see my garage, where we based some of our 3D printing and our early prototyping, our flow chemistry work. And it just goes to show you the flexibility of 3D printing. We can adapt it to any manufacturing need or what we're working on. And on the right, with the virtual reality, you can put the headsets on and meet people anywhere in the world at any time of day and talk about digital designs and convert those through to physical products in a matter of hours. This changed everything. The speed of development with VR tied to 3D printing was a massive eye-opener for us. So why 3D printing? Well, it gives you the ability to work with materials, any structures or any ideas and shapes, and any applications. And using these sort of like 3 different concepts, we can think about an application we can develop a material for, or we can have a structure, we can have an application and a material. You can vary all of these things with 3D printing. I'll just show you one example. Why 3D printing? Well, here we have a typical research laboratory, and when you open the fridge, you will find in a chemistry lab probably about 100,000 million pounds worth of valuable chemicals developed over many millions or many millions of research grants sitting in a fridge waiting to be smashed on the floor. Because people don't buy support flasks for these. They will balance them on cork rings shown on the right hand side or old bottle caps. Because the flask holders, which you can see below shown in red, are very expensive. These are currently about £23 each from Aldrich or Merck, which are hugely expensive. So people waste money or risk valuable research because they won't buy these simple objects. With 3D printing, you can see the top shelf where we have our 3D printed objects. We can make these ourselves for less than £1 per unit. So looking at our lab, reasons why we got into 3D printing was this. We can make these ourselves, and we can save more than the cost of a 3D printer just by doing these ourselves. But more importantly, we can save our valuable research. And again, if anyone wants to make these, just follow the link below. So this goes to show you the one concept of 3D printing, that ability to solve problems quickly and easily, just by having an idea. So why 3D printing and virtual reality? Well, they seem two different worlds, but they're not. Both of these different worlds are linked by CAD design. And you can see here very early on, when we're looking at 3D printing as our concept for teaching, we take a digital design and we realize a physical object. Virtual reality is just the inverse. We take a physical object, and using virtual reality, we can take that physical object, digitize it, and place it into a virtual space. So those two worlds are overlapping, the blending of the real. What does it look like in my laboratory? So here we are in 2021. We've digitized my laboratory, and so we can easily then jump from the real version on the left-hand side. If I place it on a VR headset, shown below, anyone in the world can be transported to my digital laboratory, shown below on the right-hand side, and move around in much the same way as we can in real life, but now we can meet up with anybody in the world and reduce our carbon footprint by doing so. Our software platform runs on both the Quest and PC mode, and this has taken about 2 years from concept through to actual products, but simply because we have expertise in CAD design and 3D printing. We can also run it in link mode, so again, you can show it on a big screen with a headset and explain that to others. And that utility in developing the iFlow and bringing it to market was what really drove us to this, and actually understanding technology and how to utilize it. Because in reality, what we want is equity of training globally. We want to be able to send headsets, not people, to allow access to big equipment, expensive equipment for our students. We want real-time interaction. I'd love to be able to meet you here today and show you around my laboratory, which is entirely possible, just by placing on a VR headset. We also want it to be as close to real life as possible. There's no point making a gaming studio. We want things to look as close to real life as possible. We want real VR. What do we mean by that? We'll actually want to have real-time telemetry coming to the laboratory, allowing anyone in the world to see what's going on in their laboratories in real time. We also want to speed up access to training. So again, part of our early work in COVID, looking at Venturi valves, you can see here, was increasing access to development of the Venturi valves.
Covering both open source and closed source printers. This enables you to look at developing different aspects of 3D printing, covering the development of Venturi valves in this case, for oxygen flow for the NHS, but the ability to look at how you make these on both open source and closed source printers for different production volumes or runs.
So what you can see there is that ability to train people and record videos, which you just can't do normally. Now, to be able to set that up would take me hours in the laboratory, but I can simply put on a headset and train people in exactly what to do over a cup of coffee. Far easier than anything you can do in real life. We've also used this with our students as well. So you can see here, HPLC training with 200 undergraduates in 1 week, which we've worked out with VR. Works amazingly. Again, imagine an undergraduate with their own £100,000 machine. You can't envisage this in reality. Now, this is a fantastic ability to train people, but also to carry out outreach. So again, using this approach, we can also reach out to schools. We can bring schools to our laboratories in ways that we never thought possible before. But what about people? Well, going back to the story of Matt, when people leave, that loss of knowledge can be catastrophic to a lot of research groups or industry. And that ability to capture that person's imagination or that knowledge, an entire thesis worth of knowledge, is such an invaluable tool for what we can do in science. So what we've been working on more recently in the last 6 months is incorporation of AIs. And you may have seen some of this in our LinkedIn posts and everything else. But what we're going to do is take our VR laboratories now and add intelligent AIs to the space. You can see here, Sam, Susan, and Ingrid are three of our AIs now that we have in the laboratory. And what we've been programmed with is the knowledge of our laboratory, where things are, how to do things safely. What does this mean is, well, actually we can interact with these people. So in our VR laboratory, we can place on a headset, we can meet them in the space, we can discuss concepts with other students in the space, and you'll see some 3D drawing pens, which we've been working on more recently. So the ability to discuss concepts, discuss designs in that digital space, which you can't do normally, it just simply changes the way we can do and think about everything. So I can take an object, I can draw it, I can pass it to anybody else. But more importantly with the AIs, is we can now interact with those.
I'm Inventory Ingrid, here to help you locate items in Laboratory 420.
So you can see Ingrid shown there can tell you everything she knows as well. You can ask her questions. You can ask her random things as well. And they will reach out to the internet and pull that information down for you in a conversational manner. But what's more important is this. For a global impact, we can also change the language in which our avatars work. And here we are running some HPLC training for our colleagues in the Middle East.
أهلا، ما اسمك؟
أهلاً، اسمي هنري ستيفنز.
شو تخصصك؟
لدي درجة الماجستير في الكيمياء التحليلية وأنا متخصص في الكروماتوغرافيا السائلة عالية.
So for those that you don't speak Arabic, like myself, as one of our students working with the avatar, she's asking about HPLC. She's asking Henry to explain to her how to carry out HPLC system, set it up, and he will answer everything that she asks of him. Now that is a fantastic ability to carry our research to distant parts of the globe. But we have the ability to speak in multiple languages to our avatars, and they can talk back to us in real time as well. So where next with our approach? Well, ultimately, it's about the blending of the real and the virtual. We can take our physical systems and now link those to virtual reality and have input and output with intelligent avatars in the laboratory. So just in a short space of time over the last 3 years, we've gone from chemistry through to digital laboratories just by all of these transformative low-cost technologies. So I'd just like to end this by sort of saying thank you to everyone that's done this work with me in the group and all these bodies for funding. And thank you for the invitation to talk today. I'm happy to answer any questions or sort of talk more at the end in sort of like the Q&A session. Thanks very much.
Thanks very much for that very inspiring talk. Guess I'll have to keep my questions to the end like the other participants, but could we have a virtual round of applause if we can do that for Dr. Hilton, please? So our next speaker is Alan MacDonald from Technology University Dublin. Alan has lectured in School of Mechanical Engineering, TUD, since 2002. He's a member of the emerging Applied Mixed Reality team at TUD, which also includes David MacDonald and Dr. Brian Vaughan. It's inspiring to see how the team have gathered expertise from both engineering and creative digital media to progress this technology. I heard first about the work that Alan and the team in TUD have been doing in augmented reality from a contact in Intel. And the amount Intel has invested in this technology is a real testament to the potential of the technology. So I'm really excited to see how Alan and the team have progressed it into a teaching environment. So Alan, thanks very much for...
Thanks to Owen for the invitation. Dr. Hilton's speech was very inspiring beforehand. My discussion would be in a different direction, let's say. I originally presented this presentation at CEFI recently, which was also being held by TU Dublin. As Owen already said, I'm a lecturer in the School of Mechanical Engineering. The three participants in this project, myself, David, and Brian, it was quite a fast track project. That's I suppose at the core of it. We moved fairly quickly and progressed in a very positive way through this project. I suppose I'm giving away the ending at the moment. We're very happy at how this project has progressed. I suppose how a viewer could take this presentation was just to see what was our workflow, how do we progress, how do we move through the project. I have some findings, some thoughts, some future content at the end, but I will move through. So just to move forward. And this particular AR pilot project, external research funding. So we did receive funding from Intel to start about this. And as we move through it, you'll understand why funding would be a fairly necessary requirement for this particular project. It is the integration of AR enhanced learning scenarios. So I suppose that the main focus is how can we improve the learning capability or the learning environment of the students as they pass through physical labs. It is almost in direct contrast with Dr. Hilton's discussions beforehand, and I think it's very interesting to see how the two can be in the same presentation but be almost in diametrically opposite directions. We chose, or a program chose itself, the Engineering Reliability Management Program, which is both full-time and part-time program within TU Dublin. And we chose a specific year within that course and identified specific labs that we would like to enhance. And those particular labs were quite hands-on, which lends itself to the implementation of AR. The project aims, so one, can we actually do this? I know it would seem ridiculous that AR being quite, it's not so much emerging at the moment, it's quite embedded in a lot of industries. Can we take AR technology, can we bring it into the physical labs in Bolton Street, and can we enhance the learning? That's obviously the primary aim. The next aim was, well, how could we improve the experience of the student? Obviously, as lecturing staff, that's one of our main goals. Is obviously it's giving information is one, but also improving the learning experience and how the students learn, as well as what they learn, is also important. But also some outcomes which are sometimes lost is how can we improve the lecturer experience? How can we improve what the lecturer either has to give to the experience, or what they can replace with other content? One of the primary issues with this particular lab, or lab session and lab location, is the repetition of questions from students, saying students would ask very similar questions at similar instances in the lab, and it may become onerous on the demonstrator, whether that be a lecturer or a technician, to repeatedly answer the same questions or repeatedly direct students to specific elements within the experiment. How could we offload that to some other medium to then allow both the students and the lecturer to have a different experience within the experiment? So it's how could we change the environment of the experiment to be not necessarily more higher order questions, but just better questions about why we will be doing this particular lab and what the outcomes are. And so they were the project aims. In terms of the AR technology and its application, we invested in a fleet of Microsoft HoloLens 2 devices. These devices are not cheap. We might as well say that from the beginning. They are approximately 3,500 to 4,000 euros each. So that expense in itself is an event in itself. Okay, one has to factor that in, and that is why the software. So that's why the funding became quite important to us. The content authoring, I'm not going to guess the authoring platform that Dr. Hilton uses. I have an idea, but the content authoring platform that we use in this specific project is directly linked to the HoloLens 2. It is the Microsoft Dynamics 365 guides, which is part of a suite of software that Microsoft has developed themselves, along with BI and a variety of other elements. So that particular software, if I was to really distill it into its most primitive form in one line, it is essentially PowerPoint for AR. But that would do it a great disservice. That is not what it is. It is far more complicated than that. But as a start point, as an entry point into AR content development, it is obviously the sister software to the HoloLens. So one would expect that the output from that would be in as good a position as possible for anyone to start. Typically within industry, it is leveraged as a no-code solution, so it's not a programming environment. And that idea of that simplistic approach of PowerPoint for AR works traditionally in industry for companies who don't have the expert, they don't have the programmer, they don't necessarily have the CAD person. To distill them down to very simple terms, I would be a CAD person. The ability to implement and manage AR enhancements to commercial, industrial scenarios is why Guides exists. So that the hardware and the software go hand in hand, and also we have the actual experiment. So myself and David sat down and discussed the number of experiments that we could possibly enhance from the suite of experiments that students would do in this particular program. And we picked one on laser alignment, shaft alignment using laser equipment. So you can see a screenshot there, hopefully, of one of the rigs that we have in one of our labs here in Bolton Street. It shows a motor drive, a coupling system, and bearing mountings for shafts. The laser alignment equipment here is mounted, so we can actually see the student would start with almost nothing. So the approach that they would have in the experiment is that they would be led through the mounting of equipment, the testing of equipment, the use of tablets and as part of the experimental procedure. There are also some vibration analysis elements attached to it, which don't necessarily tie into the physical experiment, but tie into both pre and post experimental testing, which in turn helps the student understand why they would want to be very specific about shaft alignment in an engineering environment. So this particular experiment is a very good vehicle for the implementation of AR. There is a lot of manual intervention in terms of tightening and mounting and unhooking, and a variety of manual tasks are included. And the ability for the AR software and the AR headset to direct the students as to where specifically that information or that equipment should go and what they should do with it is very appropriate in this environment. As far as developing the content, so myself and David have a task, or anyone would have a task of developing the content, and it's a multifaceted approach. But we obviously have to divide the task into or distill it down to its individual tasks, and make sure that maybe on a traditional paper-based documentation that students would get, or even a video-based instruction that they may get, how our language use is important, how our directions are important, how they could be misconstrued or misunderstood or positively understood. There's a variety of things that would affect how you would direct a student when developing the content for AR. And that was something that was very important to us as we went along. There is obviously CAD data to be developed. So as Dr. Hilton alluded to as well, as a CAD expert, we have created a variety of CAD models that didn't exist before to mimic the equipment that is going to be placed within the lab. And that CAD geometry becomes an AR overlay on top of the experimental rigs, replacement of said equipment. So that is one half of the laser alignment unit. So we have a model of that. So students are indicated exactly where on the rig they should be placing that. I'm trying to keep a few comments that were made at the end of my CEFWI presentation in terms of Q&A, and I'll come back to those or reintroduce those at a later stage. A couple of them would seem appropriate for me to comment now, but I will keep them for future. And then we have the actual AR learning scenario development with the headset. So as part of the process, we have to manually align content onto the existing elements. What you can see here in the screenshot is this particular dial gauge here doesn't actually exist. It's a CAD model of the dial gauge. It is sitting in AR headset space. One actually can't see it. To the left here, you can see some of the operational panels within 365 Guides. But so this screenshot is taken from the headset. So it shows me working with the AR content development software, placing an AR element in context with the physical rig. What would happen at some point in time in the experiment is the student would actually mount a dial gauge onto a shaft for a specific reason, and the AR overlay will show them exactly where that model should be. So they don't accidentally put it in the wrong place. They put it where the optimal position would be. elements like that, we can direct students very specifically using our AR headset and AR software. In terms of developing the software as a let's say not necessarily a best practice, but just to show what we did and how it worked for us. Myself and David would be experts in related fields to do with this experiment. So as part of black box isolated development, myself and David took the experiment and ran with it and developed our own interpretation of what the AR enhanced learning scenario would be. That didn't necessarily become the baked cake at the end, but it was the initial start point. And we were very confident at the beginning that it would be, sure, it would be perfect. Of course it would be. Myself and David are the experts. We're going to get this right first time. That's not the case. So we took a sample set of students from that specific program and we ran the AR scenarios with them. They followed through the experiments using the AR headsets. We documented pre-, and post experiment to see what feedback we could glean from the students. We, again, just a cyclical iterative revision of the content. We went back, modified, changed, updated, deleted content, added content based on feedback, and reran the newest revision with a different cohort of students. That different cohort included more gender diversity, students from different programs, to see how would the related programs, but not specifically the engineering reliability management, how would their interaction in an environment that they wouldn't be used to in manual engineering tasks, how could the headset then apply or enhance their ability to complete the experiment? That was a very good use case for us. So we could see how close we were getting to an optimal solution. And then, of course, because we can't trust students to always tell us where things may or may not be going right, we took a collection of staff from within our school, and we ran the next iteration with them. So all of the data that we're getting back from that is feeding us towards an optimal solution in an artifact that we can now keep and reuse for students going forward. So that's now, we've drawn a line under our the evolution of that particular AR enhancement, and now that's going to be used in the future, which I'll come to now. In terms of findings, positive findings with this tech, and I'm sure with Dr. Hilton has alluded to it already, the idea of VR, the idea of AR, this new technology, it's very difficult to not get positive engagement from staff and students regarding it. It's like you're playing games for education. Who wouldn't be excited to put on a VR headset? Who wouldn't be excited to put on an AR headset? That was an obvious one. So we had very little negative feedback about the idea of it. Obviously, we did have feedback, unfortunately, from a certain amount of participants in the experiments where the headset and a physical interaction didn't work very well. Some felt a bit nauseous, some felt a bit dizzy, eye strain post-experiment. The experiment was running for maybe an hour and a half. So having the headset on for a prolonged period of time, this did cause some discomfort for those participants. And that is an unfortunate consequence of the technology. The same idea would apply for VR headsets. Prolonged experience or prolonged wear or exposure to them, one can only expect to have some sort of negative physical reaction to it. So that's why the guidelines on these headsets say don't use them for a specific amount of time. More specifically, in terms of positive feedback, linking back to the project aims, was that the actual experience from the lecturer point of view within the experiment with multiple students was very different. And I can only give you that advice from what David told me, because David would have run the experiments previously. His experience in terms of what the students were asking, how frequently they were asking, he said it changed dramatically. Again, we'll come back to another question as to why that may have happened. But all of this interaction is leading us towards, I suppose, recognition of what we presumed would happen was that the AR headsets are helping the students to progress through the experiments correctly, have a much better chance of finishing the experiments on time, and also learning, or at least consuming more information and being able to process that a little bit better in the live experimental environment. So we are very positive that what's happening is positive for students. in terms of negative outcomes, well, I've made them in negative outcomes. There's very infrequently that we could come up with some negative findings. Everything we come up with is something that can be leveraged against something else. So any potentially negative outcomes from this we're now going to leverage into future research. Definitely what's most difficult for us, myself and David, as we introduced the headsets to students and staff, was just their ability to interact with the headsets. It is a new mechanism of gesture-based interaction, so the headsets will track hand movement. That is it's a very new experience. It's not something that many people are used to. Some people take to it like a duck to water, and some people were more difficult with it. And we found a staff member was wearing glasses, and he had a very difficult time or the headset and himself had a very difficult time hitting it off with each other. So that is something that we need to look at. How does that affect potential students going forward? The headsets only allow one session per student, so there's no multi-user interaction in that. That's something that we are actively resolving somewhere else. And another element from an instructional design point of view, sometimes the volume of text that you have to describe to the student to follow a particular task can actually become a bottleneck in their progress through the task. They actually have to read all of the content. And that may seem very simplistic, but that is just the nature of it. It will be the same if you gave them a printed document to read. If there's a large volume of text, they have to read it in order to facilitate the experiment properly. If we can't get away from that, but it did become apparent from some of the students that I could see as an external invigilator. I could see them reading with their eyes on virtual content that wasn't there, and possibly that had an impact on certain students as they progressed. But as I said, all in all, I'm not going to say we fluked it. I'm going to say myself and David are experts in it, and it worked very quickly, and we worked very hard at it to make it work. But we have made it work, which means that the most important thing, or the most important outcome of our testing, is that we are live implementing AR enhanced experiments this semester and next semester in those labs with the next set of students that are arriving in the stream. So we have the artifacts built, we have the labs set up, we have the testing done, and this year we have those students running it, and it is going to be part of their interaction in the lab. It's no longer a testing phase, and so that is a very positive outcome. As Intel have discussed in our discussions with Intel, they have fleets of headsets out there. So we're not reinventing a wheel, we're just implementing it, and that will then make students that come through our program more adept, or it's a new skill that they have in this particular realm. In terms of where we're going to progress with this within the school, within the group, there's a lot of threads have already started to spawn and headed out into research already. We have a number of different pet projects or mini projects already in action at the moment. They're going to continue, and where they go will then the sky's the limit, I suppose. The alternate delivery platforms, I'm not going to get very technical into that, but there are alternate modes, the content delivery and content development that's not within the Microsoft Guides platform. And there are lots of opportunities for us to research in there. And we're also going to have proposed PhD research and final year project development. So getting students to come in and leverage projects against, or leverage what they are proposing. And it may end up being less of your traditional engineering project and more of an engineering education project and engineering education research that we focus on. And me personally, that's where I will be focusing my research on. It isn't necessarily the engineering itself, but it's the educational aspect, and how are we going to help to teach the students what benefits can we bring to them? How can we make it better? How can we streamline things? How can we remove the bottlenecks that we've seen already and have a more fluid AR experience for the students? And also, how are we going to leverage in all other modes, such as virtual reality? So they all connect, and they're all related, and they all overlap. So the future is bright for us here. I see it being a real opportunity for us to generate some very wealthy content for the students. In terms of, and so that is the end of the presentation, but before, it's not going to be the end of my presentation now, because just to almost, let's say, preempt some comments and questions that we had from Sefi, an audience participant at the conference said, is it not just a fancy toy? Would you not just give them a better video? They weren't downplaying how good it was, but they just said, well, not everyone can afford an AR headset. And they are correct. Those headsets are expensive. They have to be treated with care. There's no getting around that. Could we make better paper content? Could we make better video content? Yes, but will the delivery of that be better than an AR delivery? And I don't think so. I think that the immersion within the physical and virtual worlds at the same time through AR is very useful. And that will do this time. Okay. I hope that suited. I hope that helped. Owen, how is that? Am I good?
Thanks very much. Yeah, no, that
I
was
hope I
brilliant.
didn't run over.
Alan,
Apologies. I hope I didn't run over.
Many thanks for it. Excellent talking. It's very exciting, the potential of AR, I think.
Absolutely.
As you say, there certainly are some cost issues and things, but we'll leave those questions till the question session anyway. But thanks very much. Round of applause for Alan, please. In silence. Okay. So Dr. Jerry Reen is our next speaker. He's a senior lecturer at the School of Microbiology in University College Cork. His research interests include microbial host interactions in chronic lung disease and marine biopharma enzymes and the role of these enzymes in maintaining ecosystem health in the oceans and marine life. Jerry, you can correct me if I've got any of that wrong. In his teaching, Jerry has particular interest in co-development with a focus on universality, inclusivity, and neurodiversity. His project Elevate was awarded a Delta Award by the National Forum for Teaching and Learning in 2021 to 24, which focused on virtual reality for immersive and active learning to enable students to more fully understand spatial and structurally complex systems. Out of this work, he published a very interesting paper in Frontiers for Virtual Reality entitled The Use of Virtual Reality in Teaching of Challenging Concepts in Virology, Cell Culture, and Microbiology. Even though these concepts are very much rooted in microbiology, I think the transfer to engineering is very interesting, particularly with challenging concepts in engineering. Dr. Reen also completed his master's in teaching and learning in higher education during that period, which is also an inspiring route to go. So over to you, Jerry.
Thanks, Owen. Let's get all of that in writing. Like Stephen said, it sounds very nice. So yeah, and I think the point you made at the start there is very relevant, that this transfers, I hope. I have put data into this presentation. I know it's being shared, so if you see a lot of figures in it, that's fine. You have the time to go through this in your own. Okay, and a lot of what I'm presenting today, certainly the earlier parts of it, were part of the Elevate program, and I'll mention that team, very much a team effort and very much a student partnered, the idea of co-creation with students. A lot of what you'll see today is the student perspective, really. And as Alan mentioned, that's so important that you carry that in the journey. Okay, it would be remiss to start and not mention where I'm based, which is down in Cork. We always say in Cork that it's the only university that has teaching and learning in its motto in the same sentence, where Finbar taught, let Munster learn. And if you ever get a chance, the place here on the bottom left is Gugan Barra. If you haven't been there, it's absolutely stunning. Do go down and spend some time there. Nice place to get away to. Probably an unusual figure to start with, but this kind of really encapsulates where we come from. And I think this is as applicable to engineering as it is to microbiology, molecular biology, anywhere where there are challenging concepts, particularly abstract concepts, because a lot of students simply don't see them. We make a great effort to describe these concepts. We describe molecular biology. We have the words, we have figures, diagrams. A lot of students, as far as they're concerned, they're looking at the back of the painting. They're not seeing what we're trying to picture. And just to go back to Alan's point, I think this really crystallizes that as well. There's an element where the digital or the virtual space can turn that picture around in a way that a simple video never could. So a lot of this began with Elevate back in 2019. It was a group of academics that came together and said, look, can we find new ways to enable students to explore? Give them an element of interactivity in their learning, 3D models, the idea of group work, let them test, let them learn, and the idea of developing virtual reality with students to enable directed learning. It really is based around experiential learning, the idea of micromodules, digitalization, all of these are employability skills. We were very interested in multimodal entry points. Not everybody would put a headset on. Not everybody should put a headset on. So can we give different entry points to students around the same teaching and learning outcomes and connect up their learning? And at the end of that, if we can, you can begin to achieve deep learning. You can begin to achieve an element of applied understanding where they don't just have knowledge of a concept, they can apply that concept in a real scenario. And we link all of our virtual experiences to capstone experiences. Just to give you a little bit of our initial journey, November 2019, that's when we got funded through the National Forum, through their SATL fund. And we started with great intentions. We got our ethical approval in March 20. I let that with you. You'll know the significance of that date, especially when it comes to putting headsets on human beings. We began with pilot surveys with Labster, and here we were working in the 2 to 3D space, but on computers, obviously. Pilot surveys with students, give them access, let them use, let's see what they think. We then, probably a turning point for us, got involved with 2 students from the MSc in Multimedia, and they had the capacity to turn our ideas into virtual simulations. This was, for us, fantastic. It's a skill set we didn't have, and coming together here really was transformative for our work with Dave Murphy in the School of Computer Science and IT. We were also very much conscious from the outset, we were not going to become technology wizards. This was all about the pedagogy. It was about the understanding how students could best learn in this new environment and how you can best tailor that learning experience for them. So we engaged in ABC for learning, which again, I'd encourage you, if you haven't done, start looking at your modules in that context. It's a great entry point. And for us, we're very lucky in UCC because we have CERTL, the Center for the Integration of Research, Teaching and Learning, who were able to facilitate this. So the first deep dive in was a viral virtual simulation with Martina Scallon and Brian McSharry in November 20, followed by further surveys and into molecular biology co-design, where we finally got headsets on the students in May of 2021. And I think the important point just to note or acknowledge here, much of this was done under level 5 lockdown. So most of it was done at a time when we weren't even able to see the students. It was done remotely, but nonetheless achieved. Why molecular biology? We knew anecdotally it was challenging from students, but also it's something that's fundamental to our ability to take on most of the pressing challenges in planetary health, public health. We know from the policy documents from Europe, Strategy 2020, Impact 2030, we know molecular biology is a key role to play. And nonetheless, also in addressing the United Nations Sustainable Development Goals. So there's a huge benefit to getting a cohort of students through that can engage and understand this space. But from the students' perspective, we know from talking to them that they actually find this quite challenging. It's almost universally accepted amongst our cohort that molecular biology is challenging, computational biology is challenging, and largely because it's invisible. They can't see it, they can hear the words, they can see pictures on a PowerPoint presentation, but they've no concept, they've no spatial awareness of what any of this means. It's abstract and invisible to them. But of course, in thinking about virtual reality and how we would bring that to the table, it would have been naive on our part to think, well, we can just put a headset on. They're all gaming, right? They're all very comfortable in this digital space. Yes, when it comes to social media, absolutely. Actually, nobody said they had no experience in social media. But when it came to virtual reality, a very different picture. About half the cohort said, we're not comfortable in that space. We've no experience. So students are comfortable in social media and digital space. but not in the creation of digital content or virtual reality. And I've put stars over those 4 points because this is around 2021. We'll come back, you'll see a similar figure later with our most recent cohort. So creating digital content or digital collaboration, not really comfortable in that space. Virtual reality or gaming, again, quite reticent. They're not gamers. And they're not experienced in the virtual reality space. Hopefully this will change, but we need to keep this in mind as we design the learning experience. So again, just not a strong background in VR and gaming. And this is the students' response. This is just asking them before we began. So body of work for us to do there. Another point that I just bring up here, we didn't dive straight in with designing virtual reality simulations. We developed a few prototypes, is what they call them in the technology space. We just called it a jigsaw. This was a blank jigsaw from Tiger. Walking past the shop, saw the jigsaw and thought, okay, let's try something. Arrived up to the class and I wrote 10 different jigsaws, all with the same pieces. And if you look at the center point here, it's a plasmid. All of these pieces are components of a plasmid, a piece of circular DNA that we use to make recombinant proteins, vaccines, many different types of biologic or drug and recombinant protein. All the other pieces are part of the process, the pipeline, but not part of the plasmid. Divided the class into groups, gave them the jigsaws and said, look, the more you understand about the plasmid, the quicker you'll make the jigsaw. It was very simple. I mean, they laughed for the first minute because it's not something that they were used to. But very quickly, the feedback was, do you know what? The very act of doing this is sticking in my head. Like I've done this before and I couldn't tell you one piece of a plasmid from the other, but the very act of doing, the physical act of placing the pieces, it's actually sticking with me, it's resonating. That's when we knew we needed an interactive element to our VR design. It was also very important for us that in designing the VR with the students, that it was accessible. So it's web hosted, it's not linked to any gaming engine. And we still maintain this through the Azure platform. So the people who developed this, Christine Walsh, Grace McAvoy, they were the MSc Multimedia students. Billy O'Mahony, we were lucky to hire an outstanding individual who really brought huge value to this and turned it from simulation to VR. Just to give you a quick idea as to what some of this looks like, this is just one of the simulations where the students can enter. They put in a code, that way we could see and we could link performance to surveys and keep the feedback. The microscope, yes, you're right, that's a standard microscope, and no, you cannot see DNA down a standard microscope at that scale, but we just needed something to bring the students out of their own environment, to trick the brain almost, to know that it's going into a different place. So the students here are given the backbone of a plasmid, they're given fake pieces or decoy pieces and real pieces, and they have to assemble the plasmid. So there's an element of knowledge required here. You have to know the pieces and their correct orientation. After that, the students go through into a simulation that describes the process. So what happens when you've actually made that plasmid and you see the plasmid? You can actually explore this in this three-dimensional space. You can walk around, see the helix. And then you have the bacteria where the plasmid is electroporated in. So the students go through and they can see the entire process. Because remember, in a lab, this is a clear liquid in a tube. That's all they're going to see, liquid in a tube. So this enables them to see the process and understand what's happening in the lab while they're in there. And then finally, when they see that plasmid, it can go into the human cell, and here they can explore the human cell and see the various components, walk around and see how the plasmid turns into protein. So from the student's perspective, there was a clear role in engagement, and going back to Alan's point, positivity around their experience. Yes, hugely. Importantly, there was a need to link and scaffold with the module content. And you see this again with the digital labs. Really important that it's not done in a vacuum. This needs to be scaffolded in your labs, in your pre-labs, and in your lectures. And pre-training was important to ensure accessibility. You don't want them to come in, just put a headset on and try and understand how they have to navigate the experience. There's an element of pre-training, and once they're trained, then they're up and running. As I said, we link these to capstone experiences. In one case here with the plasmid experience, we link to a molecular canvas, which is a group project that all the students engage in, where they work from isolation of DNA from a pristine source all the way through to bioreactor and GMO requirements. It's not enough for the students to come back and say that they enjoyed the experience. You really want to get evidence that they're learning and understanding better than they would in a classical lecture. And by getting them to perform their understanding and apply their understanding in a real life setting, that's one of the ways you can begin to capture this. We did publish as well, in addition to our research, a roadmap. It's there for you in Frontiers in Virtual Reality. It's just one perspective, but where we see VR and the integration of virtual reality, augmented and XR, we see the importance of an introductory experience to set the scene, to scaffold the journey the students are going to go on to. Then you've got your virtual reality experience, but don't leave it there. Link that to a performance of understanding and bring that back. Bring the feedback back to your introductory experience and onto your virtual reality. So very much an iterative experience is what you're looking for here. Constantly learning, constantly adapting. Some of the positives around it and the feedback from the students. It's universal, it's accessible, student-paced. They love the idea that they can do this in their own time. There's nobody standing over their shoulder. They can get it wrong, okay, and learn from that in their own safe environment at their own time. It's very much an entry point to accessing knowledge. These critical concepts that are core to the experiments that you're performing. It's a way to enable access for all, or greater access. You can build new mental models. You can break down existing ones by bringing students into a virtual space. And you can get multiple outcomes, enable them to see connections between concepts, which is equally important. There's a lot of work goes into that, and I would suggest that you need a team to really deliver. Some of the building blocks, you need the scholarship expertise to understand from a UDL perspective, or teaching from understanding. You do need the support services. So we work closely with disability support and the library in UCC. You also need your VR development, the ability to turn this into a technology. I know I will never get to a space where Stephen Hilton is with his capacity to generate this work. In my case, it's collaborating out. And the disciplinary expertise. There's a lot of different components that are needed to really make this happen. If you get that right, then you can begin to frame your abstract concepts, and you can begin to get your scientific accuracy, your fidelity, but also from a VR perspective, the touch, the spatial, the sound. We never think about what a plasmid sounds like when it comes together in ligates. We've no concept around that. What would it feel like to pick up a piece of a plasmid? That does enable you to generate the digitalized experience for learning. It can be interdisciplinary, new knowledge, new skills. And the hope is that you'll eventually turn that picture around and let your students access, where before all they saw was the card that it hung upon. So COVID, then we'd come out of lockdown and we kept going with the students and we kept going with the headsets. Interesting in how the perspective might change or might not change now that we're out of COVID and we're all back interacting again. But what was really interesting was, in spite of the 2 years, very, very similar trends emerging. Laptops and smartphones, yes, very accessible. But again, video game consoles, no. Now, this is one student cohort. It's covering several of the sciences, the life sciences in UCC, but this is the feedback we get from students. They're not all gaming. They're not all Xbox. And again, remember those stars from earlier? We're still seeing that they're not experienced in virtual reality. In spite of the world going out getting headsets during COVID, a lot of these students are saying, no, we're not that comfortable not that experienced. We're not comfortable, but not that experienced in VR or gaming or the creation of digital content. They're very comfortable in the digital space. They're very happy in social media, very happy in digital forums, communicating in a digital way, but not in creating content and not in VR. So again, a body of work for us to get that introductory experience right. This is another interesting point that, maybe you look at going forward with your own students, and how this will change over time will be interesting, but a recurring theme in what we've seen. The digital experience, and you'll see with the blue color, very positive feedback, a very strong motivating factor, but the lack of peer learning is not seen as a barrier. You might think it would be. The students have the headsets on and they're typically working in their own space. That doesn't faze them. They're actually quite comfortable with that. It's not a barrier to them, peer-to-peer engagement. There will be developments in that space in VR, but at the moment, that's not a barrier for students. In this case here, you've got Labster, here you've our own VR experiences that we've engaged the students with. We did quite a large survey recently through the digital inclusion funding that we got at UCC and through the College of CEFs. Again, just looking at the gender breakdown here, biased towards female. The programs biased towards biological science, but we also have BSc education, plant biology, biomed, biotechnology, food science. And again here, just looking at the outcomes from this, because I think these are very positive, but there are some take-home messages here. So over 100 students. So you see the yellow just tells you the box that you're looking at, but here's the message at the bottom. So the digital labs were accessible and easy to navigate. Yes, absolutely. Found the concepts and techniques in the labs easy to understand. Yes. Just to make the point on this, these are both VR experiences, but also videos that were made by the School of Microbiology. So the two together. Where it comes red, where the student said, no, I don't disagree with that. I understood the concepts and techniques in the lab better than if I was there. No, they like the in-person experience as well. I found the digital labs abstract. No, they're quite comfortable with that. If they're done right, they get a lot from it and quite comfortable learning in that space. Looking at the next two, very positive again, they were useful, but watch this point, not a substitute for the real lab experience. It's not about replacing. This is very much something that will work in tandem. Elements will be VR, other elements will be in person. Also to point out, these are microbiology or life science students. Seeing the different stages of the lab made it easy to understand the concepts. Again, a recurring theme, whether it's a lecture or a lab. Being able to navigate through the lab in my own time helped my learning experience. The student pace element of this is huge. And I could apply the understanding I got in other modules, this idea of you're creating new knowledge and new ways of learning in these students that they can apply beyond even the labs you've designed. They're going to benefit from this in other learning experiences throughout the college. And having completed the digital labs, I felt better prepared for the in-person labs, again, working hand in glove. Looking in a broader sense of their learning, if we look at where the positivity is here, experienced, online videos, online resources. Digital labs, very comfortable, quite happy using that. Where they're less comfortable, group learning, library reading, again, gaming, and research labs. I think a reflection of the fact that we've just come out of COVID, where it's been very much a distance experience. So we'll watch this going forward and see where this lands. And with the student learning experience, I learn well through digital media, well through lectures, but watch this important point over here. I would like to see lectures replaced by online resources. No. Again, they see this as something that works with the labs, with the lectures, not something that's a replacement. So what do we pull out of this so far? 5 years of investigation and implementation, no end in sight. So I think we're all in that space, right? But that's because we're interested in it. Interdisciplinary engagements are critical. Reach out to those who can do. Evidence-based strategic approach gets buy-in at school level, and it's all about accessibility and driving systemic innovation. We were very lucky to get the Delta Award because we had such a fantastic team behind this project. So from a student's perspective, and just to mention, some of this work is published as well in FEMS and has just last week come out in their special thematic issue on empowering learning, so it's maybe worth a look. Broad access to digital resources. They're very strong in digital tools, but less so in VR and gaming. A broad range of learning modalities are used by students. They're comfortable in the digital space, but lectures are not sufficient for concept development. We have gone on to do a UCC Digital Inclusion Bursary in David Woods with these 3D models. We're also in secondary schools where they're working in the cells and learning about cells in the VR space through the SSPC EPE bursary, and more recently with 360 videos with Dr. Niall O'Leary leading that through SATL. These are the amazing people I've had the privilege to work with, and the anonymous students from the surveys, we've no idea who they are, but they were incredible and they enriched everything we continue to do. Thank you very much.
Thanks very much, Dr. Ian. It's great to see UDL being developed in these technologies as they're developing. And I think that that co-development approach has really got a lot of strength. So now I'm going to go over to my colleague, Dr. Anne Morrissey, who has kindly agreed to collate the questions. If there aren't too many questions, I certainly have a couple myself, and we might open it to a kind of an open discussion forum if the speakers have some time.
Yeah, the one question in the Q&A is from Alan. The question, is there an AR headset for every student?
In this particular lab, yes, there is. We have it's a reasonably small lab space. There, if you can remember back to the presentation of the rig, which was set up for the laser alignment, there's 8 of those rigs that were custom designed and built by my colleague, Dr. McDonald. And now for each of those rigs, we have a separate AR headset. Yes.
So how many headsets? How many headsets is that?
Capacity of the lab is 8 students, the capacity of the lab is 8 rigs, and we have 8 headsets. The live non-AR enhanced version of the lab would hold 16 students tops, but now that is a squash. So we now have 8 rigs, 8 headsets. Yes.
So I think a follow-up question for that is, how scalable is this as a teaching tool?
Because it's contextual, so the AR interactions are contextual. It without the real life context to overlay the AR data onto, it's VR. I say just, I don't mean just. We revert to a VR or swap to a VR environment. And the scalability is depending on the space. If we are implementing it to 20 students with 20 headsets, we need 20 rigs. That's also tied in with industry as well. So when industry are training staff using AR headsets, they still need the space, or else you're into a cyclical scenario where you have different students in different places at different times, and you just iterate the labs, and there you get more throughput. But we are in a physical constraint, simply by the amount of rigs that you can interact with.
Yeah, I think there's a comment there as well. I'm not sure if it's visible to everybody, about the use of the cardboard style headsets with a mobile phone as the actual screen. Actually, I've actually tried that out myself, and of all the ones I've tried, it was the one I could use the best, because the other ones I got really, really dizzy and nauseous with, which I think was a comment from some people.
Can I jump in on that slightly?
I was going to ask you there. Yeah, I was going to ask you there. Yeah.
So, like, I suppose in terms of the throughput of the lab, Alan, how independent are students in that AR environment, or are you still have a high staff-student ratio?
No, well, one lecturer or one technician per lab session, perfectly fine. When we were testing, it was because myself and David have different like expertises merged into one in the development of the content. We were both looking at different aspects of the same lab, but we would have multiple students in, and as I alluded to, the experience is very different. There would be no reason why one staff member to 8 to 16 students couldn't suffice. And there's no need to have more, from my own personal opinion.
And kind of jump on that cardboard question there. I mean, so Android have unfortunately dropped their support for LiDAR technology. But if they're to bring that back, and LiDAR was to become more commonplace in our mobile phones, can you see a scenario where there is an AR version of cardboard essentially? Or even a throughput on some of the VR technology that would make this more accessible to
the levels to where you would need to be. We are leveraging the technology that's on the headset. So the headset is giving us feedback. So it's camera sensing. If we were to push it further than where it currently is, we have hand interaction being tracked. Sorry, camera tracking, hand tracking, eye tracking is all built into the telemetry of the device. If we want to get any more specific with that, then we are you would need that telemetry within the device for it to loop back on itself. Mobile phone use may have you may have an AR light scenario where the overlays are there, but maybe you don't get the hand interaction. Maybe you don't have eye interaction. There's a variety of things that would be you'd have to compensate for in the development of the content to allow the lesser hardware to work. But like, so Apple have their magical thing on the way as well, and we'll all see how that goes and how good or bad that is. And there are different platforms from different hardware manufacturers, and they can leverage different pieces of software. So the HoloLens isn't the only one, but it is the most widely known per se. So if the HoloLens 3 is cheaper and better, like the way the Quest 3 might be better or cheaper than the Quest 2, then these things will evolve over time. But as far as the cardboard model, I think that the limitations of hardware will reduce the flexibility of the interactions that you will get from it.
Yeah,
that's my own personal opinion.
I mean, in terms of the software, sorry for hogging here, but that 365 guides, that seems really intrinsic to these. We have a couple of headsets here. We don't have 365 guides, and they're kind of hollow, you know, to excuse the pun.
Change the branding. Change the brand. No, absolutely not. No, it depends on expertise, and I absolutely positively will guess that the two other speakers, Jerry and Dr. Hilton, will have experience of Unity or Unreal Engine as content development softwares, and they both link directly to HoloLens 2, but they are an exponential leap in content creation expertise required to develop that. So you trade off what you can and can't do based on the expertise that you have and the technology that you have. So I've been developing content for the HoloLenses using Unity as well as an alternate platform, and it works and it's fine and everything is great, and that is a way of doing it. But you have to then, as Jerry alluded to, you have to have then the team of experts there to be able to create that. Whereas with the 365 guides, you don't necessarily need as much expertise to do that. You still need expertise. As I look back and talk to other people about it, we kind of flippantly say, oh yeah, it was grand, sure, I was able to do it, but that's because we're experts at what we do. So of course it would be. We distill our own expertise down when we look back and we say, oh yeah, it worked for them. But if you were to hand it to somebody else or some other team, they may not have as much of a shortened project time. So we only had 6 months. So we've developed all of that content in less than 6 months. So that shortened time frame may not suit everybody. It's still possible, obviously, but you can't. If you want to then not use 365 guides and use Unity instead, you're leveling up I'll stop talking. Level up your expertise needed. If that helps.
Yeah, there's a question in the question and answer there as well, which I think might have been kind of answered. But by the way, you've answered the other questions. This is the question: is there an advantage to using the headset versus, say, using a mobile phone similar to Google Lens?
Yeah, I would hope that I would have answered David's question in tandem to what I answered with Owen, possibly.
Yeah, I think so. Yeah. So I have a couple of other questions coming in here as well.
If I could just jump in for one other thing as well, also just to Owen, seeing as you talked about 365 guides, there is an infrastructural cost as well. In order to have guides up and running, you need Microsoft Dataverse up and running within the IT infrastructure. So that's another licensing and cost implication that can have an impact on funding or projected fundings. 365 guides costs is a perpetual license structure as well. You don't buy it outright. So there's an annual license for that as well.
I might ask you about some of those details offline, Alan, if that's okay.
Can I just maybe see if Jerry or Stephen have anything to add to that, because you're coming at it from a different perspective rather than just the engineering. And I think in Stephen's case in particular, you're focusing more on outreach and getting your people experiencing labs without actually using headsets per se. So maybe either of you would like to comment on that, and it maybe include, if you can weave into your answer, how big is the appetite for this really? You know, is it just being driven by one or two companies and it's kind of like a technology trying to find a solution or a reason for using it, or is it just something, a vanity project for a certain number of industries?
Yeah,
Do you want to
certainly.
take that, Jerry?
Yeah, I certainly wouldn't think it's a vanity project. And just on the use of the technology, the one bit of advice I would give, if the graphics are off, forget about the experience. So whatever you'll save on having a cheaper entry mechanism or technology, you will lose in engagement. You generally, when people put on the headset, if the graphics are good, the experience is good and they'll engage and learn and they'll work through. If it's fuzzy and poor graphics, then it doesn't matter how good your simulation is, I think you'll have lost them. We've had a lot of conversations, and just even what you've been talking about there, about the technology, the cost, the accessibility, the scalability. Like, we always look back to 97, 98, when people were going around with mobile phones and other people were saying, yeah, but look, do you need that? And then it became a mobile smartphone, and then do you need that? And just look at how society moves. So I think what people are speaking about here today, the really important thing that I'm taking from it is the learning in how you go about integrating VR into what you want to achieve. Because I think the technology will catch up very quickly, and in the next couple of years, it'll be as common to have a VR entity as to have your phone. There'll be integration. The technology will become accessible. What we have to get right is how you develop and how you integrate that with our teaching, which is why I think the work that's going on is so important. So my view is that the technology will fast catch up, and the scalability, when it becomes the thing to have VR. That goes back to the question then, why not just have a two-dimensional, why not just give them a video? You know, and we see it's almost a gradient is what we see. Not every student will need the VR fully immersive. Some students are going to be very happy to have a three-dimensional experience on the computer where they can rotate the graphics, move it around and see the various elements. Some might even be quite happy just to see the cell. That's how their process work and how they see it. But there's definitely something, because as a scientist, you pride yourself on logic. Yet when you put on a headset and you're in a room with a plasmid, and your brain is tricked into thinking this is entirely normal, that the plasmid is as big as I am, I can even pick pieces up and connect it. The bacterial cell is over there. It's okay that I can touch it. VR really does bring you into that space. And obviously AR has its own advantages as well. So I think it's a very different experience in VR. You just have to be very clear from the outset, from a teaching perspective and learning perspective, what is it that you're looking for in a virtual space versus what you could just deliver maybe on a computer or in a video. And that's where the teaching and learning comes in, the pedagogy and the scholarship.
That's following that, Jerry. I think it's the VR is great. So this is a fantastic medium for giving a lecture today. This is the best way of doing it. For remote connectivity, there's no point doing VR for this. Where it comes into its own is that it's that pure information environment. There's no distractions. It's not the phone on my desk. I'm getting text messages about the cat being outside or doing whatever. You block everything out. You can really focus on that task in hand. That doesn't have to be an hour in VR. 10 minutes is probably sometimes better than an hour lecture. So it's that quick in, quick out digital information. And I think it's got to be based on need. If a flat screen works, use it. Don't waste time. It's where you need it for that digital information. Can I meet an engineer and talk about what's wrong with the HPLC? I can fix it in 5 minutes, where that'll take me 4 or 5 hours fiddling around outside of that.
Yeah, I mean, can I throw in my own tuppence there? Is like that, videos are great, lectures are great, VR is great, and like what I'm using a lot of is 360 video type VR, and with information, and then you build up to more interactive VR, and then maybe move on to the actual equipment where there is AR, and that, I think that's kind of a natural progression in the thing, but I think you're right, Jerry. I mean, figuring out the right pedagogical approach is actually where we need to be at, because the technology will move so quickly that it'll outpace us.
I definitely agree with what you said there, Owen, in terms of that stream, that there's a sequence, and Jerry alluded to as well. Not every student has to go on from paper to video to VR to AR, but the connections between the two would only make the learning that much more for the student. So if they, like, the AR is different and it has to have the contextual, but it's the sequence of teaching someone core concepts through VR to then be applied in AR, or there's a variety of ways you could mix it, but they are all overlapping and they are on an arc that works. That's the experts here beside me have agreed on that as well. I think there is a connection to all of them together, and it doesn't replace the lectures and the students. And Jerry has said that there's, although some of my attending students would disagree by not attending, but that's a different story altogether. There's none. You can't migrate your lectures into VR and AR and then put your feet up. It's just not going to work that way.
No, when I saw some of your AI technology, which is really interesting addition, Stephen. Sam, Susan, and Ingrid, was it? It'd be interesting to see how they get on in an AR environment, because usually my students are wandering around the real lab going, where is this or what, you know? It'd be great for them to be able to pop up and go, oh, here's, you know, where we keep whatever it is.
I think that's the aim. So we're looking at the Quest 3 as being that device to do that. I mean, the HoloLens is fantastic, but the cost is quite high. So we're really looking at the Quest 3 as being our entry to that point where we can have 4 or 5 of those in the lab. They get covered in solvent. Okay, it's an upset, but it's not a big £2,000 upset. That is a big difference. So that is our next logical stage, and we're heading that way. But AI, I mean, that changes VR enormously. That 6 months ago didn't really exist. It's changed everything in terms of what we do now. I mean, student posters, for example. Imagine a student can ask for a poster. So we have our posters for our students in VR. They can talk about their work 24 hours a day. No need to be there. They can go to the beach somewhere having a nice cocktail.
Yeah, just even talking about the pipeline there and thinking about it. One thing we're very interested in Cork is getting to a space where the students become the creators. So a lot of it has been co-creation, but you see from the feedback that there's a little bit of hesitance about digital content creation. But can you imagine a scenario where the students' learning experience for challenging concepts is where they storyboard and begin to design a teaching experience? So they learn by doing, by deconstructing the concept and finding a way to teach it. I mean, how better can you learn? To design a VR simulation that brings real value in VR, that opens up new concepts for students, who better to tell that story in a way the students will learn than students? So it's another element to this. As VR becomes more accessible, can we see a future where the students themselves, as part of their learning environment, are constructing these simulations, and it's peer learning, it's student-paced? I think that would be fantastic if we can facilitate that. And the work that's going on at the moment is really about that. It's understanding the technology, it's understanding the pedagogy, and it's finding how do you bring the two together.
Well, coincidentally, within our manufacturing engineering degree program, level 8 degree program, where we have a student now who's starting on a process of experimental learning and AR enhancement himself. So he's going to be developing AR scenarios that we can then reuse as an artifact for future students. So it's exactly what you've said there, Jerry. We're not guiding him. He's going to learn the labs, and he's going to reconstruct them and enhance them. And it's from a student perspective now. So where we obviously as the experts would know where he's going to learn and find his own pitfalls, and where he thinks as a student his content would then best serve other students. I suppose that's where we're heading. It literally just, it's hot off the plate. That student may not necessarily like that I've said that, but that's what he's doing. So we're at that cusp now of letting the students create the content.
With some of the veins, so we actually use the students now creating their AI avatars to help teach programs or parts of the curriculum they found difficult over the last few years. So the final year students are now creating content for the undergraduates at the first and second year level. And those AIs then help them understand the concept. So we have like a spawner on the wall, any equipment or objects or 3D sort of things like molecular models, for example. They can pull those off and they can chat to the AI about that. And it's that creating the AI content is actually quite straightforward. It's just conversational interaction with the AI in that case. That works really, really well.
Okay. So thanks a million to all our speakers. It's just hit the 2 o'clock mark, so I'm just conscious of it. But maybe we can continue the discussion afterwards. So thanks very much to all our speakers. And I don't know, there's no other round of applause, so I'm going to give a round of applause. But thank you very much for giving your time, and hopefully we'll get to discuss again in the near future. Okay.